Hello, everyone. This is Todd Sledge and Chris Klug from the Cincinnati VA Medical Center. Welcome you to another edition, or one of our first editions in series of Beyond the Boots podcast from the Cincinnati VA Medical Center. And before we get started, get to know us a little bit, and thank you for tuning in, as we always look forward to talking about the benefits and services that are available to our veterans here in the tri-state. And before getting into some of those things, take a little bit about myself. My name is Todd Sledge. I'm the Chief Communication Officer for the Cincinnati VA Medical Center, and I've had the privilege and honor for the last 34 years, Mr. Klug, here in Cincinnati, taking care of veterans, so I'm very happy about that. And Cincinnati native, like I said, long-time career with the Cincinnati VA. Been my pleasure to try to bring as many veterans into the healthcare system, make sure they got the benefits that they can secure and make some life changes, for sure. So my colleague Chris Klug, he's a public affairs specialist. He's been in my office for a few years, and very happy to have him. Stole him away from some things he had going on. So Chris, tell our listeners a little bit about you.
Yeah, I'm glad to be here. Thanks, Todd. My name's Chris Klug. I've been here going on 4 years. I am a former Army military veteran. Served with the 101st Airborne for 4 years. Did one tour in Iraq. Got out, used the GI Bill to go to school at Xavier, got a bachelor's, master's degree there, and now I'm working for the VA and couldn't be happier.
Yeah, there you go. So what a good lead-in right there, all the benefits that you have available to you. You talked about the GI Bill. I don't know if you used the VA home loan to buy a home or not.
I haven't yet, but I
not
will
yet.
one day.
Oh, there you go. It's a good maybe a secondary home. Maybe your wife would be like, let's buy something else. But so let's talk right into our benefits. You know, there's so many things that go into the benefits that are available to veterans, but primarily what we want to talk about is your health care benefits from the Cincinnati VA Medical Center. And if you don't know, we're located down here in Clifton, 3200 Vine Street. We are situated between the Cincinnati Zoo and UC, and right behind the University of Cincinnati Medical Center. So you're not far to find us. If you've gone to the zoo, you've passed us right there on Vine Street. We are a full-service medical center, which a lot of people don't think we offer everything available to veterans, just like everybody else, what I refer to as Pill Hill there in Clifton with all the hospitals. Yeah, we're a full-service medical center. A lot of people don't realize that. Primary care, surgeries, oncology, orthopedics, prosthetics. We have a nursing home. So many different types of services that are available through the Cincinnati VA. And then also we have 6 community-based outpatient clinics around the tri-state area that you may not be familiar with, but we'll touch base on that here in a second. But Chris, what you and I really want to focus on is these myths and misconceptions about what keeps veterans from either finding out what their benefits are or enrolling in VA healthcare, which is very significant. And so we're going to run through some of those that you might think, well, here's one of them. I have private health insurance. What do I need the VA for? And you've got some great examples about that, if you don't mind sharing.
Yeah, I'll share one of them. I do have a few that I'll share in some later podcasts, but one was I found a primary care provider that I truly liked. He was a great provider, worked for a big hospital that was not VA. Left that hospital, went to the VA, and I was able to follow him and use him as my primary care provider at the VA.
Yeah, so that's a big reason. If you like your provider, if you're picky like me, and I only talk to certain people about certain things, that relationship is key. So, there are many different benefits. A lot of times veterans will say, well, I don't want to give up my private health insurance to to use the VA. You don't have to. There's a lot of advantages to keeping your private health insurance. Sometimes I'm just recently talking to a veteran about like, hey, can I use the VA and keep my Medicare Part B or Part A? And I'm like, well, actually, you don't need to keep Part A or Part B if you use all of the VA services for your health care. So there's a lot of different benefits and advantages there. And if you want to know how to get enrolled, learn about all the different benefits, you'll hear this number throughout the podcast here over the next few minutes. It's our eligibility number, which is 513-475-6499. That's 513-475-6499. It's a 10 or 15-minute call with our eligibility specialist. They'll walk you through what your benefits are, see how you're eligible. You do have to enroll. You do have to be eligible for VA healthcare. We do have eligibility requirements, so give them a call and see what they can do for you. But let's get back to those myths and misconceptions. So private health insurance, yes, you can use the VA. The VA is not only for veterans who served in combat or were injured in combat. It's for any veteran who has 24 consecutive months of service with an honorable or general discharge. There are some exceptions for other than honorable discharge, which is for veterans who are seeking mental health services. There are some exceptions to that, that other than honorable, which unfortunately does happen in the military. But 24 consecutive months gets you in the door, and it's a great way to explore how to make us part of your healthcare portfolio, which is, again, we are not insurance. These are benefits. So if you're out in the private sector right now and you're not enrolled in VA healthcare and you're paying a lot of money for prescriptions, or you're paying a lot of money for specialty clinics, or you're paying a lot of money for different kinds of procedures, or you're paying a lot of money for the crave of changing lifestyles with whole health, where you have a nutritionist and exercise and how to eat right. All of these things are under one umbrella. And Chris, they're significant benefits.
Yeah, they're great benefits. And I think one of the other myths and misconceptions is that you're taking a benefit away from another veteran.
That's the big one, yeah. Yep.
That's what I hear the most.
We hear that a lot, don't we?
Yeah, all the time, especially from my friends, too. And I'm like, no, you're not. This is something you've earned. You're not taking away anything from anybody. There's enough care to go around for any veteran that wants to enroll in VA healthcare and use us as their provider.
Yeah, and we say that very loosely, but seriously, it's one of the biggest things we hear all the time is like, hey, I came back with my arms and my legs, and I came back, got good lifestyle and different kinds of things. And that's great. That's where it's awesome that's happened. But to Chris's point, these aren't like benefits aren't like cans of soup on the shelf where we're going to have so many in a given period of time and they're gone and they're not available. We have plenty of benefits. So you're not taking anything away from someone else. You're not taking up an appointment spot or a clinic spot or the time of the provider. You're basically, these are your benefits. And, one of the other major advantages, Chris, and I know because of your experiences on both sides, the fastness in which you can get into the VA compared to the private sector with specialty clinics is very unique.
Oh, yeah, especially if you look at specialty clinics like dermatology.
Yeah.
I know some people that have had to wait a year to get into their dermatologist, where you can get in much, much faster.
Right, absolutely. A lot of people don't know that we are congressionally mandated to get you an appointment within 30 days. If we're unable to do that and it's a specific medical condition and your doctor is willing to provide the exceptions to the 30-day rule, we can refer you out into the community, which is our community care program, which is a big benefit when it involves different travel and stuff. So, this is the reason why we're doing this Beyond the Boots podcast, is because we want to eliminate some of those myths and misconceptions, those barriers to veterans that may have thought about, maybe I should do this. Why should I do this? What's the significance of it? I have friends and buddies that use the VA and they rave about it, but I just have not kind of made that decision. And that's really where I want to transition to is, one of the things you and I talk about, Chris, is getting enrolled before the age of 50. Because I'm getting ready to turn double nickels here in a couple months. And in the last really 24 months, I've spent more time managing my health care and doing healthcare stuff than I ever did in my life. Getting the required tests, doing lab work, trying to lose weight and do those different kinds of things. But if you wait till you're after 50 and you go on in life and say that you experience some significant health issues, I've heard time and time again, I know you've been hearing it more and more in your 4 years, is, well, Dad's a veteran. Why are we spending all this money in the private sector, chewing things up?
Yeah. It's something you should definitely get enrolled in earlier in life, because that does expect it. If you lose your job and lose your health insurance, anything could happen.
Yep.
So the earlier you get enrolled, even if you just use it as safety net, you should get enrolled.
You hit it, safety net. That's really what it is. So if you've got good private health insurance, if you've got a COBRA plan you're comfortable with, you've got coverage through your spouse, multiple kinds of things, I would layer the VA healthcare system as your safety net in case some of those things change. And it really did change during COVID. When a spouse was carrying the health insurance, they didn't have a job any longer, or retirements, somebody retires before someone else. And we see that all the time. People continue to stay on working when they really want to retire just because of the health care. Yep. And and if you can supplement the VA in doing that's a big bonus. Plus, I guarantee you, if you tell your employer that you're using the VA, you're saving your employer some money as well on some of those premiums. So again, there's many, many advantages to becoming enrolled into the VA healthcare system. To start that process, if you're not enrolled, you call 513-475-6499. That's 513-475-6499.